think you've all seen the pattern where each spring we'd like to have at least one form health-related, sort of helping us stay healthy. And so we discussed, if you recall, we've looked at sleep problems, we've looked at joints, and I said it's time to look at the heart. A lot of older adults are concerned about heart health, and so that's what our topic. And I got my cardiologist to come. So this is Rajesh Vakani. He's a New Yorker and been in Raleigh about 10 years, from New York City, medical school in SUNY Buffalo, and then trained in Albany, and then we've been very lucky to get him in North Carolina. He's with, you might know this out at Rex Hospital, it's a huge practice. I mean, it's North Carolina Heart and Vascular practice that is attached to the new Heart and Vascular Hospital. So I guess I've been your patient about 3 years, and look how healthy I am. So Dr. Vakani, thank you.
Thank you.
We look forward to hearing your remarks.
Thank you, guys. My goal was to talk about heart, but let me talk about myself first. So I'm Raj. I'm a New Yorker at heart, trained up there. So I have 2 beautiful boys and wife. We've been here 10 years. We enjoy North Carolina. I think I'll probably retire up here. That's my goal. I enjoy teaching, and I do a lot of teaching with different places. I teach at Campbell University, also UNC students come over to Rex. And I've been in practice roughly now for 20 years. I've been a doctor for 21 years. Practice as a cardiologist for 14 years. My goal was to keep a very simple talk about heart and vascular and cholesterol. So I'm not going to go in details, but I want to make sure you understand general stuff, because that's more important. So if you guys have questions, please keep it in mind. You can also interrupt me, feel free. So 4 things I'm going to try to cover. What is heart disease? Okay. Understanding cholesterol. What do you mean by cholesterol? What do you have to worry? What is vascular disease? And how do you take care of yourself? Well, how can you take care of your well-being? So we'll try to cover points on each one of them. Okay, so let's start with the heart disease first, and then we'll go. So let's start here. Why do we need to learn about heart disease? Well, number 1 cause of death, still. You combine all the cancer, still heart disease, number 1 cause. Okay, so yes, people die most from heart disease, and then when you add vascular, then there is no, because vascular, when we say it's stroke and related. Okay, so then how many, heart attacks? More than 500,000. So you're talking about 600,000, and now it's gone up a little with population growing. So every 40 seconds, there is a heart attack happening in the US somewhere. Overall, about 9 million people, in the world have heart attack, and about 20 million people die. That was my fault, but that's okay. 20 million people die yearly of heart disease worldwide. So it's a large numbers. Interesting part, men tends to present early with heart disease, in their 60s on average, female, older, but when they present, the female are usually sicker. So they present late, but they are usually sicker at that time. And there's different reasons for that. So there is a lot of sex differences in heart disease. There is racial differences. So keep that in mind. Caucasian, Indians, African American, each one of them have, Caucasian tends to get more older age, while African American Indian gets much younger age heart disease. In terms of few things you perhaps want to, it's about general health. Okay, so this is interesting number if you look here. Obesity has become an epidemic here. So 40% of population is obese. About adult population, 50% are hypertensive. Big numbers, okay? Cholesterol elevated in 1/3 of population. I'm talking adults, so if you have to skip the kids, okay? 10% with diabetes. So imagine if you take 330 million people, 10%, okay? That's diabetes. So 30, 31, 33 million people with diabetes in US. So what are the risk factors? So the risk factors for heart disease. So I tell patients, people ask me, why does heart disease happen? Why do you get disease? Well, let me put it this way. Can you stop your skin from changing as we age? No. Can we stop? I'm losing hair. Can I stop? No, I can't, naturally. I can do artificial stuff, but point is, things will happen to your body with time, outside. So, just like that, the inside of the body will change. Okay, so when we're born with arteries like this, okay? Up to 20 years old, you know, but as we age, they did a wonderful studies in 1950s in US, Army cadets. You can't do that now, but you know, people who died in the war, they looked at their autopsy, and you'd be surprised, Army cadets had cholesterol buildup like that. You know, Army cadets, these are people who are well-built, muscular, athletic, eat right. They had cholesterol buildup. The point is, cholesterol buildup happens at young age. And with time, it gets worse. Okay. So what are things that makes it worse? What are things that predispose you to have this? So what I'm referring here is to the heart. But the concept is similar for the whole body. So if you understand, here, similar, carotid artery going to the brain, okay? Kidney arteries, kidney disease, okay, some degree. Vascular disease, same. So this is vascular disease. When I talk about heart disease, the pathophysiology is similar in other organs. So what are the risk factors? Elevated LDL. So if your LDL is very high, it predisposes you. You have low HDL, bad cholesterol. We'll talk about those two later when we talk. Diabetes, very important. Three things we always, a lot of cardiologists would say, that gives more importance for heart disease. Diabetes, smoking, and family history of young age heart disease. Those patients, we already put them on higher risk category. So hypertension also. So those are risk factors that will damage your vessels, basically. Okay? Then there are minor risk factors. Obesity, lack of exercise. So being obese but exercising is still better than being obese and couch potato. Okay? So keep that in mind. Which one do you rather have? Would you have a couch potato and lame, or would you have obese and exercise? I'd rather have obese and who's exercising. That's more important. So the point is, both are important. Psychological stress, very common in female. They tend to get broken heart syndrome. I deal with so many each year at Rex. Okay. What are the other risk factors? Well, what we talked about, things that you can help. These are things you can't help. Age. As we age, every decade of life, things will happen to your body, as I mentioned. You can't help that. You can help the other aspects, the ones we saw before. You can't help being male. You can't help if you have a family history of young age heart disease. So there are some risk factors. So then people say, why you get, if I run 10 miles every other day, why do I still get heart disease? Well, there are things you're doing, but there are things beyond your control, okay? If you didn't do things right, then you, instead of having a heart attack at 60, you probably would have had it at the age of 40. And then there are other risk factors, which I'm not going to get into. Homocysteine, for your intensive purpose, we can skip those. So what are the key signs for heart? Chest pain. Chest pain, okay? Pain, important. But remember, not everyone gets pain. Especially female. Are very confusing, okay? Sometimes they just don't feel good. Doc, I don't feel good. They feel short of breath. They feel fatigued, tired, more tired. dizzy. So their symptoms are not typical at times. So we always pay attention to female. Okay. So we always say, hey, as a doctor, I have to characterize the pain. But keep in mind, heart is just one of many organs here. So you have other organs too, right? You got your lungs, you got your esophagus, you got your stomach, gallbladder can cause, muscles, joints. I can list 30 things that can give you chest pain that are non-cardiac. Okay. Symptoms overlap. So we always have to, as doctor, try to understand. And even the best doctor can get fooled. Okay. They do. Body is complex and people are complex. Okay. So we try to understand what type of pain you get. That helps us as a heart doctor. We try to dissect it. And then we try to see what are the symptoms you have. Are you getting short of breath? Are you getting tired? Your body, is it giving up easily compared to 1 year ago, 2 years ago? Remember, not everyone gets chest pain. Okay, people gradually decline what they do. They don't push their body aerobically enough to get into trouble. But something happens, boom, then. So what happens then? People say, oh, I'm aging. But there is sometimes more than just aging. Okay, there are other things happening and we adapt. So keep that in mind. You know, pain going to the arm, left arm particularly, jaw, exertional pain, pressure. That's something I want you to keep in mind. If you have symptoms when you're exerting yourself, okay, when you're doing stuff, and I feel like pressure, and that's something that wants more attention, okay? I'm getting short of breath much more easily. Now, shortness of breath is a mixed bag, but I don't want you to ignore it. Lung disease can cause that too, okay? But point is, I don't want you to ignore that.
The heart is the most important muscle in your
So
body.
I'm going to mute this guy, okay? Because what I wanted to do was, I want to play this. So what I want you to, why am I going to do that? Well, you know, it's important to understand your body, okay? You can't help it if you don't know what it is. So I always tell patients that take responsibility for your health. Don't rely on others. Let's see if you can get it to play this way. It's like, I was going to make a comment, it's like my wife, you know, doesn't listen half of the time. Just kidding. She'll beat me up.
The heart is the most important muscle.
Okay. What I'll do is, find out how to mute this guy. Okay, there you go. So what I want you to understand here, heart has 4 chambers. Simple stuff. Right side, left side. Okay, the body sends the blue blood, less oxygenated blood with veins to the right side. And that blue blood will go through the right upper, go through the right lower, which pumps the blood to the lungs. The purpose of lung is to get oxygen in, carbon dioxide out. The red blood will come to the left side and go from the left upper to left lower. Now this is the big muscle, left lower, that pumps the blood to the whole body. So that's the bulk of your heart muscle. So when we talk about heart attack, we're usually talking about damage to that heart muscle. Sometimes it involves the right lower too, yes, but the bulk of muscle is the left ventricle. So it's good to know some basics because you can't help yourself unless you know some simple stuff. So keep that in mind about your body, okay? So chest pain, remember, this was a young man, not young, but I call 70-year-old young man. He ignored his chest pain on and off for 2 weeks, okay? He was having symptoms for 2 weeks. He's diabetic, smoker, hypertensive, okay? He presented with pain for 2 weeks, pressure, and we see this quite often. Doc, it's heartburn. Of course not, it wasn't. His pressure, he was pretty intense when he came to the ER. His pressure was bad, his heart rate was up, he's in respiratory distress. He's having a full-blown heart failure from a massive heart attack. This is a massive heart attack happening. And it was happening for 2 weeks. Okay? So we see this quite often. People ignore stuff. So this is just heartburn. There are 3 things that mimic a lot each other. Heart pain coming from heart. Heartburn. That's why they call it heartburn. Okay? Because burning sometimes feels like pressure. And people say, oh, it's heartburn. But then it's the pressure, and pressure is similar, actually. So you can't differentiate sometimes. We as heart doctor can't, unless we do more stuff. And third, musculoskeletal pain can sort of mimic sometimes. So, we're going to understand what atherosclerosis is. So remember, I told you, accumulation of fatty material. Fatty material in your arteries, basically. These are the arteries, okay? In the heart. So they get buildup of cholesterol, okay? These are the arteries going to the brain. They get buildup of cholesterol. That's what atherosclerosis is. Remember, it starts young age, okay? And happens all over the body. So these are different areas that I'm pointing, okay? And that's what it is, basically. It happens gradually with time. Things that can help is, remember, the modifiable risk factor. Control your diabetes. Control your blood pressure. Control your cholesterol. Exercise. Don't be couch potato. Be healthy weight. So otherwise, it will happen more younger age. So, coming back to the heart. Why heart is important with the arteries? Well, think about it for a second. Does your heart ever stop? What happens if your heart stops pumping? For 6 seconds, let's say 7 seconds. If you're bicycling, right? When you canal, your heart stops pumping for 7 seconds. What's going to happen? Take a guess.
You die. No, you go unconscious.
Before you die, you become unconscious. Blood is not getting to the brain. Okay? So, people start losing consciousness. Why? The brain is not getting the blood. Okay? Brain is very sensitive. Next, the heart is very sensitive. Okay? Those 2 organs, damage is irreversible. Overall, heart we can still help. Brain, yeah.
How quickly does that happen? 7 seconds?
I'm just making a general. Anywhere
Okay.
from 5 to 10 seconds.
Okay.
If you don't have a heartbeat, 5 to 10 seconds, you will start feeling dizzy. You will start becoming woozy. You may hit the ground.
So that's what happened to that basketball player when he got hit.
Different stuff. That's
Oh,
arrhythmia.
football player.
That's an arrhythmia, which is a whole different thing.
Okay.
Okay? But that's, it's a whole different topic. I can
Okay,
go an hour.
okay.
But that's a different mechanism. So here, if your heart has electrical issue, it doesn't beat for 5 seconds, you're going to feel it. My point is your heart never stops. It stops, you're dead. After 10 seconds. I'm saying 30 seconds, 1 minute, 2 minutes, you're dying, essentially. Okay? So this muscle needs blood all the time. It can't have interruption. It has interruption, you start feeling it. Okay? So that's the point of this. So what is coronary artery disease? These arteries that get disease, and basically it will help. These are the different arteries, right-sided artery, left-sided artery, which splits into 2. Okay? They get disease, the muscle can't pump. And that's what ischemic heart disease or coronary artery disease is. When there is an abrupt event, that's a heart attack. Okay? So basically that's what I pointed here. Okay? So right here, heart disease, when you have a mismatch, your heart, say you're on the UA canal, I'm coming back to you since we're talking, or he's not running anymore. So when you're pumping hard, how many times your heart is going more than normal? The cardiac output goes by what? 3, 4, 5 times. You know that?
No.
So it can go up. So it has to keep up. those arteries dilate, okay? If you have disease, you can't get more blood. So there's a supply-demand mismatch, and people start getting pain. Make sense? Okay, one more time. This is the cholesterol buildup, okay? This is important. I'm gonna put this down so I have a free hand now. So, basically, what happens? There's a rupture of those plaque, and that's where the heart attack happens. Platelets, your blood factor binds. So, a lot of those blockages are not 80, 90%, those are 30, 40%. They rupture, and complete occlusion, that's what heart attack is. Okay? So then how do we fix it? How do we help it? If someone is having issues, stop, rest right away. Then what next? What are you guys gonna do if your neighbor is doing something? You don't have a phone.
Aspirin.
Aspirin, 4 baby aspirin or a full dose, then what next?
Call 911.
Try to get some help, okay? If you don't have help, find nitroglycerin if someone has it, okay? If they have it, ask them. If you have it, you can give yours. Nitro, that's fine. Rescue emergency medicine, okay? Under your tongue. Helps the heart. Call 911. You rather be safe than be sorry, okay? So even if you don't think it's your heart, do you want to take a chance? No. So then what's the next thing? Some people, did I skip a slide? No, that's fine. So we end up doing catheterization besides medicines. We give them aspirin, a lot of other medicines, blood thinners. Yes, young lady.
I have a question.
Yeah.
Oh, thank you so much. If you give someone aspirin, I heard something that they're supposed to chew it rather than swallow.
Chewable aspirin is better if you have it. But if you
What
don't
if
have
it's
it,
a 325 milligrams?
that's fine. If you don't have it, then you give the regular. That's okay. Something is better than nothing. Okay? So if you have chewable, yes. But most people don't keep chewables, right?
So do they chew the 325 milligrams?
No, you take it. No. If it's not chewable, you just tell them swallow, like any other tablets. So catheterization is basically, we go in through groin or the hand, and we would inject dye into the artery. We come up here, or sometimes we go through the hand, okay? We go with the catheter. You see the catheter moving? And right there, we would inject dye into the artery, and if there is a blockage, like here, then we would fix it with a stent at the same time. Then what does the stent look like? Well, this is what the stent looks like. It's a metal scaffold with medicine built in. Helps to open up the blockage. So this is what they do when you hear stents in the heart. That's what the stents look like. Sometimes we put stents here. Sometimes we put here. Sometimes here. Similar. So you understand this, then you have a rough idea. Okay? This is the ultrasound of the heart. Some heart doctors, well, we do it. For a heart doctor, this is gold. It tells us a lot what the heart is doing. 4 chambers. So we often do it, but there's a lot of reasons for it. Right, Chuck? You have had it, you've been tortured many times, right? Yes.
When a stent is inserted, does the doctor take out the cholesterol at the time and the plaque?
So, depends. If there is a lot of calcium buildup, they have to go roto-rooter, and try to suck some out if they need to. But otherwise, they crush it against the wall. You can't just take it out easily. It doesn't work that way. What you want to do is restore the blood flow, basically.
A couple of years ago, I read a layman's article saying that research was indicating that stents didn't seem to make that much difference, but I know several people who would say they made a whole lot of difference.
So,
And their cardiologists would too, I think.
So, do you know why people live long now? Take 20th century. Take a guess. What was the age we lived up to?
You mean when?
I mean, average age, 1920s, 1930s.
55.
55, 60.
Yeah.
Why are we living longer?
Better health conditions, health care.
Better health? Number one reason is heart care.
Healthcare.
Heart care.
But our
Okay,
mortality
there
is
has
starting to
been-
go down with that.
There has been a big revolution in heart care more than anything else. And oncological is progressive, but they're still lagging, okay? Heart care has improved, okay? People get saved by heart attack from stenting. Otherwise, they would be dead 30 years ago.
So probably,
Statins is the other reason. People blame statin. Statin helps to control inflammation. There are the other reasons that people are living longer. People blame statin. The media has a lot of, ignore media, please, on that.
yeah, I'm figuring that a year or two we'll read an article saying that the mode of data analysis on this meta-study that said stents didn't make a difference, that, they evaluated the data wrong.
So let me put one thing, okay? Cardiology is the only field, it is data-driven, data-proven. There has been millions and millions of patients studied. I'm not talking, okay, between different trials, over 30 years. There is no if and but, okay, that it saves. It is baloney. I mean, I'm talking thousands, millions of articles out there, probably, if you include all over the world, okay? So it's not even if and but. What are the medicines you would need? Aspirin. Once you have a heart attack, maybe Plavix-like medicine. Okay, your heart doctor will do that to keep you stay alive longer. Statins, beta blockers, and I may need to speed up a little. And control your diabetes and follow up, okay? So, questions for me so far on heart disease. We covered only one aspect here. I'm going to speed up a little because I do want to cover the other, okay? Okay. So what is the next one? Understanding cholesterol numbers. Now I'm not going to go in details, but I want you to understand your cholesterol numbers, okay, general. So 4 values when doctor tell you, what are they? Bad cholesterol, which is the LDL, okay? Normal, less than 100, okay? LDL, bad cholesterol. HDL is a good cholesterol. Less than 40 is abnormal. You want it 50s, 60s, okay? And then total cholesterol, less than 200. And the 4th number is triglycerides. You want it less than 200. Why do you care? Why do you care? Why do I care? Remember this, okay? Remember your heart. Remember your brain. That's why you care. Or legs. Tell you a sad story. I never seen this in my life, okay? I had tears in my eyes. One 60-year-old, he had lost 2 legs. 1 arm at rest. He's admitted under us. We have to chop his 4th arm. Diabetes and host of. But point is, that's what vascular disease is. Okay, all 4 extremities gone. Okay.
Excuse me,
Yeah.
I've heard that a critical thing is relationship between HDL and LDL.
True.
There's a there's a-
Percentage is there, but I don't want to make it too complicated. If I throw too many numbers, so I keep it simple. There is, lipoprotein, but for your intensive purpose, I would say you want this less than 100, you want triglyceride less than 200, and HDL you want it above. So LDL is the most important. You want to know that because that's what bring up all of them. Okay. So when do we decide you go on a cholesterol medicine? It's a complicated answer now. It used to be more simple before. They made it a little complicated a couple of years back. The guidelines changed, different national agencies. So a doctor has to make that decision in conjunction with you. If someone had a heart attack and stroke, automatically they'll be on a statin lifelong, unless they have issues. That's given. Or vascular disease. If you don't have those, then the decision depends on what is your actual number and what are your other risk factors. And then they have to calculate your benefit and risk. Okay. So this is where shared decision making is important. You and your doctor decide, hey, what's my benefit and downside? Okay. And then what are the options? Well, number 1, lifestyle. You have to eat right. Eat healthy, cut back on, red meats. You can have it. I never tell patients don't have it. But moderation, keep it in mind. Keep saturated fat in mind. Exercise, that helps. And eating fish, chicken, red wine can help, okay? Medications. There are a few medications out there right now. Statins, obviously. There is Zetia, then there is one more new one, naloxone, which I don't even put. But there are injectables too now. Last 2 years, 3 years, we have those every 2 weeks. So those are for patients who can't take statins. So controlling your cholesterol is important for this reason, okay? This reason. What is vascular disease? Well, this is going to be a simple atherosclerosis in the other arteries, okay? The arteries going to the brain, that's carotid arteries. Arteries going to the left, vascular disease. Legs, renal arteries, they can get disease. Even your belly arteries can get disease. So sometimes we end up stenting those. So stroke sometimes happens because this is a carotid artery, okay? This is your chest, and this is blood going to the brain. Imagine patient is lying that way, okay? It bifurcates. As we get older, you see the plaque here? Look at this and look at that. Okay, so it narrows more and more. That's what this is. It can break off, go to the brain, and cause stroke. Or it can really clog off, and blood circulation compromised. Blood can't go. The cells start dying. Time to save it, shorter than the heart even. Remember, irreversible damage. Not like your skin. The vascular, it's the legs. Same thing, arteries going to the leg. So people start cramping in the leg. If they exercise, I can't do it because I start cramping. Back of the leg. So that's it, one of the signs that the arteries are diseased in the leg. I'm not saying that's the only, but that could be one of the signs or symptoms. Okay. And can cause ulcers eventually. So obviously you don't want to wait until then. Then you're too far out. That leg will go. So again, lifestyle, medications, aspirin, similar. Okay. Last point, I'm going to come. Your health and well-being. Who is going to care about you more than yourself? Is there anyone else? No, right? Technically. Maybe your spouse next.
I was going to
If you have a
say,
spouse, that's the next closest thing.
she gets me to go to see doctors.
Right. Let's say we lose spouse. I have patients who lose spouse all the time. Who's going to take care of yourself then?
You're on your own.
Right. So you have to learn to take care of yourself. I had an 80-year-old female. Doc, my husband took care of everything. She was devastated. He died 2 years ago. Okay. Sweet as hell. I didn't know anything how to do. He took care of everything for me. When he's gone, there's no one there. She got sick last year, 1 year after he died, and they're spending a month in our hospital. Then ended up going to Charlotte nursing home. But my point is, you still need, if you know how to take care of yourself, you can survive better, okay? So you are still responsible for your health. That's my point. The guys are more careless than ladies are, actually, honestly, okay? That's why I always tell spouses, come, bring your wives, because they don't know half of the things, half of the times. The wives tell them, okay? So understand about your health, it's important. You are responsible for your health. I mean, who's going to give pardon my language, I'm a New Yorker, shit about you more than you. You have to learn to take care of yourself better. Make a book. I tell all my patients, make a health book. If you have high blood pressure, diabetes stuff, write down your blood pressure, heart rate. If you're doing finger stick, you go to your doctor, bring the darn book in. Bring your medications or list with you. Yes?
You talk a little bit about slow heartbeat versus fast. I mean, sometimes you think about 50 is good and not. And
I'll come to that when I finish this one. But yes,
Oh, okay.
hold that thought for a minute. Yes, I will do that. Yes, I won't forget. So, you want to become active players rather than passive. So, what we do as Americans, you know what? And I'm being honest. I was born in third world country. I was born in India actually. I was raised partly there. Then I became a New Yorker. Okay, I've seen how the healthcare is rest of the world. I go volunteer every year in Caribbean, once a year. I've been doing it for 12 years. You don't know what people have there. They have nothing. We have a lot more here than rest of the world combined. We're not appreciative and we're not responsible enough. As I think we need to be more responsible for our own healthcare. We're not. And sometimes we do, unless you go out there, you won't know what we have, honestly. We have a lot more than most of the people in the world. So I think if you use those resources, you can become a more active player. You know, keep in mind you have everything here at your site. Understand your medicines. Just don't say, oh, doc, I take that blue pill. Please, I don't know what blue pill. I hear that a round pill. Please don't. Pills change from pharmacy to pharmacy. You know that? Colors can change, same medicine. Okay. So, point is, you know your medicine. It doesn't take much. 5, 10 medicines. Okay? That's responsibility. Okay? Why am I taking that medicine? That's responsibility. That's what I want you to do. Because that's what's going to help you. Healthy lifestyles. Okay? So regular walking exercise is paramount. Even if you can do little, it's important. Very important. So I tell patients say, hey, I can't go. It's the hospital, but that's fine, I'll call them. I can't walk much. Say, do what you can at home and take a break. Then go back at it. Do what you can. Upper body, lower body, whatever you can do. Sleep is important. People who are sleep deprived will tend to have more heart disease. Eating healthy is always important. Minimize caffeine. Don't go crazy on it. I mean, at this, I don't see a big problem here. I see a lot more in younger generation with the caffeine. Taking medicines and regular follow-up. Okay, so you want to do regular follow-up. Prevention is much better than actually when you run into disease. Okay? So in summary, what I want you to remember, atherosclerosis starts at a young age. It's not when you're 40. I'm going to start behaving when I'm 60. Too late. The ship has sailed already. So you need to start behaving at a young age if you can. So tell your grandkids, kids, get on the ball. Heart disease still #1 killer, okay? There are a lot of treatments in CAD. I mean, cardiovascular is the frontier in medicine, basically. Why? Because they do innovation, procedures, stuff that everyone else follows, okay? Because we're crazy, type A. Usually cardiologists are more get-go, okay? More adventurous, and that's what helps. You have to take a risk in order to. So cholesterol treatment, remember, don't fight it. Even my family fights it, for God's sake. I have to tell them, take the darn medicine, will you? I mean, why people think taking medicine is bad? Why? Why? Because it's going to help you live healthier and longer. Or it's a chemical. Well, it's a chemical. You go some of the natural stuff, plants. Those are chemicals, essentially, right? These are proven chemicals that may have more benefits. Some downsides, but what comes in life free? If someone tells you I'm giving you something free, there's always ulterior motives, okay? So there's always pros and cons, okay? So keep that in mind. There's pros and cons with everything. Vascular health, remember that, and then regular. So my number, if you want to take one thing from me, become proactive about your own health. That's what I want you to take. So know your stuff, know your disease. What do I have? What medicine am I taking? Why am I taking? What prevention can I do? Okay? That's important. So when you become proactive, you're thinking. Okay? Your mind is thinking. That will help you avoid future event. Say, hey, something is happening not right. Or maybe you will help your friend. So that's why it's important. So you become proactive. That's one thing I want you to get out. Okay? The rest will come naturally. Okay? Now, answering your question, heart rate. It varies. So I have athletes whose heart rate will be 30s to 40s. Okay? And that's okay in that circumstances. Older population, I have still who are very athletic and they're still active, their heart rate may be 50s. And when they sleep, they may go to 40s. That's okay as long as they're not symptomatic. But most people will be in the range of 60 to 100. Most people. And then you have electrical problems, which is a whole different topic that I haven't even, there's a lot of other cardiac disease. There's heart failure, there's electrical issues, there's so much other stuff. Obviously I can't talk about everything, but those are electrical. I can talk 1 hour on just one electrical disease, AFib. Okay, there's so many others. The point is, there is a lot of other things that can make your heart go fast as we age. So we have to keep that in mind. Yes?
First of all, thank you for the picture of Victoria Falls.
Yes.
And secondly, would you recommend a group like this, or even younger than this, that wants to embark on something like an exercise program to get a baseline EKG before they start?
Baseline EKG is always good. Yearly physical at this age would entail a baseline EKG. So every year, if a patient comes to me, my patients, they get an EKG. Because they're cardiac patients automatically, and most of my patients are. Some are more high risk, and I still get it. They're not heart disease yet, but we're trying to help them. So I have patients who have heart disease in the family in the 40s and 50s. They are more proactive, so they come see us. Yes?
Yes. So when someone goes for a cardiac workup regarding blood work, do you routinely include a thyroid panel because that affects the heart, the thyroid?
So it depends in the situation. So if someone is having fatigue tiredness or palpitations, then yes. But if you're having chest pain, I may not routinely. But I do tend to automatically on most of my patients, if I do blood work, I do include TSH. Because sometimes it can present different ways in different people. So most people I do check TSH. Unless their primary care are managing and I'm not managing, then I don't. Okay. Any other questions? Yeah.
So we just bought a new blood pressure cuff. For strange reasons, we had to spend more money, so I got the one with the EKG on it. Is that useful at all, the home EKG?
So,
That's another reason.
mixed bag. It generates a lot of anxiety, for sure, okay, in patients who don't know how to do it or who don't know how to interpret it, okay? It's not doing it, it's the interpretation that matters. So it doesn't help if you don't have, I have, that's one of the live core that you can say, and you have AFib, okay? It'll tell you that. It's smart enough to do that. Those are maybe helpful in AFib patients, not all the patients, okay? Patients who we're worried about, but not in a general sense, no. What you want to do is blood pressure and heart rate monitor. Unless you have electrical issues in the heart and you understand some stuff, like AFib, okay. So I have some young patients, I tell them, because they get episode maybe once or twice a year, they understand how to do it. They save it on the phone, then they send it, but then we get influx from everywhere. But that wouldn't, I think keeping blood pressure and heart rate is more important than actually EKG. Any other questions?
So
Yes.
AFib is something that you sometimes can tell, but sometimes you can't tell. Is that correct?
So again, people, you can think of that as a short circuit in the heart. And there's lights here, right? There's wires. Okay, the wires allow the lights to turn on, just like that. There is wires inside the heart, okay, that allows the heart to beat, upper, lower, okay, normal heartbeat. As we age, those wires and heart cells can get disease. And upper chamber starts misbehaving, and that's what AFib is. Again, long topic, but some people will feel palpitation, some people don't feel it. Some people feel short of breath, some people feel tired, some people feel dizzy. Each one is different. Again, topic by itself, but that's a electrical short circuit in the heart, basically. And treatment is complex. Like today, we have to shock one of my patients in the ER because she can't tolerate it. All right, guys. Yes.
You had mentioned stents. So is like coronary bypass surgery less common now, or than
It is. That's why the surgeons are out of jobs. So that is a fact, actually. About 20 years ago, they decreased the size of cardiothoracic surgery residents nationwide because there are less surgery. Because we fixed the arteries with stents. And the stents have gotten better every few years. So we're in 4th generation of stents. Medicated stents, they last longer, they're more durable. So there is a lot of advantages. When we can't put stents, or the disease is complicated, or there are anatomical issues, then we say you need bypass. But I tell patients, stents, right? You had stents, right? Or bypass, if anyone had it. It's not a cure. People need to understand there is no cure for heart disease. We don't have it. No one has it. What we do, we temporize it. We buy you more time. If you misbehave, it buys you less time. So people who start doing smoking, number one issue, you're going to come back with a heart attack again. So if you don't eat right, you will have issue again, sooner than later. The point is, understand that whatever we do with vascular disease, heart disease, it's not a cure. It just buys you more time.
What is the ratio of, say, stents to bypass surgery now?
I don't even know, because every year it has been just steadily going down. Because everyone actually automatically gets evaluated for stents first. I'll come to you in a minute. If we can't put a stent in, then we call the surgeons. Then your time. The surgeons are not first option. No, they're not. Because who wants to be chopped open if we can give you relatively similar outcome with newer stents? Unless there is complicated disease, then we recommend surgery. Yes?
Made me think, what's the status of heart transplant today? I mean, we read about attempts to actually develop pig hearts that could be transplantable, but what is the status of heart transplant today?
We're still going to be behind. Body is complicated.
Yeah.
We know a lot. There's still, we don't know a lot.
Yeah.
Okay. And this is an amazing machine that never stops. Okay. And you're trying to bring someone else's machine and tell your body that recognize that it's your own machine. The body says, no shit, no, it's not. It's going to reject.
But there's still...
So they are working, but it's going to take 10, 15, 20 years. The need for it has gone down. So when you have a need for something gone down, the research goes down, right? Sorry, New Yorker, crap language. You can blame Queens, inner city schools.
Okay, 2 questions. We all build up plaque in our arteries. Is there any way to reverse that buildup of plaque? Is it whatever you get? Is it that's what it's going to be, and it's all you can do is just suppress it, or can you reverse it?
You and I find that cure. We'll be not billionaire. We'll be trillionaire.
So it doesn't exist.
So technically, it doesn't exist. The closest thing we know is statins. The closest thing we know. What we know, statins, besides bringing LDL down, it stabilizes the plaque. And maybe some studies shows regression.
Really?
Maybe. Yes.
Okay, and then the second question, as I was telling you before we got started, I was trying to avoid going on blood pressure medication by exercise, eating. I did that most of my life just fine, but started this past fall on blood pressure medication. I used to take fish oil tablets a lot, and then I read stuff that said that's just all bogus. Do you have any opinion about that? Does that do anything for your vascular health?
Fish oil?
That kind of stuff.
Maybe, but it's not. Fish oil helps the cholesterol, triglycerides. doesn't help. I mean, there is no data to say it's going to help your blood pressure. It does help cholesterol in terms of the one fraction of cholesterol, which is triglycerides.
So it may slow down plaque buildup potentially.
But would it affect the blood pressure? No, we don't have data. You were saying blood pressure, right? Here's a, see this simple thing, okay? This is the heart, main pumping chamber. This pump is pumping blood to the aorta, okay? So remember, aorta, the pressure inside the aorta is your blood pressure, okay? That's what, this pressure here reflects your blood pressure, essentially. That's what I'm telling you. That when you have a blood pressure, we measure 150. That's the pressure inside this aorta, okay? So the heart is pumping blood, okay? This is a door. So door opens this way. Heart is very logical, I'll tell you, but that's another 1 hour topic. But the door opens. Imagine the blood pressure is 180, 160. The door has to work harder to open, right? I mean, the lower the pressure, see, this is what it means. The door it's giving resistance. So blood pressure being elevated is a resistance for heart to work efficiently. That will cause thickening of the heart muscle with time, problem. So if a snake comes and bites you, what are you going to do? Human mentality, I'm going to go get help, right? Right, I'm going to call 911. High blood pressure, diabetes, cholesterol are not acute diseases. They are chronic diseases. When we have chronic disease and impact, human brain doesn't accept the consequence right away. That's how we are. We're a human creature, we're complicated. We don't see the downside of that right away. But there is significant downside over time. If you have a heart attack, you wake up right away, right? Next thing, I'm going to change my lifestyle. High blood pressure is like that. You know, it's not poison, but it's a slow poison. You put a lychee on someone, it just drags your blood out slowly, slowly. It's like that. So the longer you let it go on, the more problem you have. So you do what you can. Exercise, lose weight, eat right, give yourself 3 months, 6 months. If it's high, then don't kick the can. Take the medicine. Okay, that's what I tell my family. That's what I tell you. Okay. Good? Any more? All right. Yes?
One thing, I'm not even sure how to pose the question, but I have a teenage grandson who is in he's trying to build himself up, and he says he takes all these supplements.
Muscular,
stuff,
yeah, protein shakes.
proteins, and he says I need more fat. I need more fat. I'm thinking that's not right. You're talking about build up. Is it okay
So,
for a teenage boy to be pushing that kind of stuff?
it depends what they are ingesting, okay? If it's maybe relative more protein, okay, and not so much stimulant and other stuff, maybe moderation is okay. But if you end up doing too much, then it's harmful. And if you end up, a lot of them have a lot of ingredients that gives you caffeine and other stuff, junk, because they want to stimulate you, all that, that's not good. Maybe just a little, someone is bulking up they're exercising to put muscle on, and they put a little pure protein powder, that's okay. But a lot of the other complex stuff, no. Mixed bag, so depends on what's in the component, and not too much. Yes?
Just very quickly, would you address the issues of things like low potassium, magnesium on heart rate?
It can affect it, but usually that happens because either a patient is on a medicine that drops it, or someone is in dehydration zone because of diarrhea, vomiting, and stuff. So that's and it's usually dangerously low, not just little low. We're talking like potassium, that's very low. But if they drop, you will start cramping. Not dangerous low, but enough low, people will start cramping in the legs. Okay, so keep that in mind. Yeah.
Yeah, would you speak to hydration? I mean, I get orthostatic hypotension, but I'm told that you need to drink more water. What's the effect of that on heart?
So again, depends on the patients. Okay?
Individual
So,
differences, I
the
know.
general population, if you don't have heart failure, and you don't have a weak heart, okay, or you don't have kidney disease, or cirrhotic liver, then hydration is good, okay? But you have selected diseases that warrants fluid control, like a weak heart, then you can't do overhydration. I limit my patients with heart failure, I'm talking, or patients with dialysis. But
Really?
most of the other population, keeping yourself hydrated is important. Okay. Yes. But at such certain stage, you don't want to do too much if you have other diseases. Thank you, guys.
Thank you so much.